with Dr. Anthony Chafee, where we discuss diet and nutrition and how this affects health and chronic disease, and show you how you can use this to optimize your health and happiness, both mentally and physically. Hey guys, just want to take a second to thank our sponsor, the Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. But for those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25%. Hello, everyone. It's Dr. Anthony Chafee with another episode of the Plant-Free MD, and I have a very special guest today, Dr. Stephen Hussey. Thank you so much for joining the show. How are you, sir?
Doing well. Thanks for having me.
Great. So for people who don't know you, can you tell us a bit about yourself and what you do and you know what you just wrote a book recently, and just tell us a bit about that and more about the book.
Yeah, for sure. So my background is I'm a chiropractor and functional medicine practitioner. But my health journey is what kind of spawned this book that recently came out. Because as a kid, I had a lot of inflammatory conditions, everything from irritable bowel syndrome to I used to break out in chronic hives all over my body, just swell up everywhere. I had allergies and asthma and all kinds of stuff. And so that ultimately ended up with me being diagnosed with autoimmune type 1 diabetes when I was 9. And so that heavily predisposed me to heart disease, as I would find out later on when I asked, the doctors why that was. They said, oh, because it damages your arteries, higher blood sugars over time will damage your arteries and make you more prone to atherosclerosis and things like that. And so, my family and I were kind of thrown into the world of Western medicine to manage these conditions. And so we did that for a while. And then it wasn't until college until I found out that the way I lived my life had a direct impact on how I could manage these conditions. And I'm happy to say that all those conditions are gone, aside from the type 1 diabetes. That's kind of collateral damage from that inflammation. But yeah, so I started, experimenting with lifestyle and things like that, and found it curious that no doctor ever told me that this was an option for me. And so then I went to get a medical education, and I thought I was going to learn everything there was to know about being healthy, and I didn't. And so it's just been this never ending journey for me, this quest to figure out what actually creates health. But it was always, every time I heard about heart disease and things, I was like, oh yeah, I'm predisposed to that. I'll figure out about that. And so I had like no filter. I didn't care where the information came from. I just wanted all. I wanted everything about the heart and heart disease and health in general. And, I started to figure out that a lot of what I was learning, and there's a lot of information and science out there that did not match up with, the conventional wisdom or what, Western medicine told me, or even my chiropractic degree told me caused these diseases. And so, eventually I had this huge accumulation of information, and I just decided to start sharing it on social media, and people liked it. And I kind of became known for this hard information, and eventually put it down into a book, and that came out in April. So here we are.
Awesome. Well, and that's the thing too. We have a lot of us, get into the healthcare professions and want to learn about this because, like you say, I want to learn about how to be healthy and how to get better and all these sorts of things. And unfortunately, that really isn't what we learn. We're sort of cogs in a wheel, or cogs in a machine of of whatever system that you're in, and that's hopefully, there to, well, it's obviously it is there to support people's health, and it does in so many different ways, but it's not necessarily, as efficient or as good as it could be. And, we sort of focus on our little bit, like in neurosurgery, we just focus on this, and we fix the problems that show up with that, instead of, sort of treating the person holistically and saying, like, how do we prevent from getting these problems in the first place? Because a lot of things that we do, and especially in the specialties, it's just hazmat damage control. The problem's already there, and we just need to fix it, and that's fine. There is a role for that, and we need to have that, but that's we shouldn't be in a position that we're creating more problems, and I think that it's, the spirit is there of actually finding out what it means to be healthy, as a person, and how to pass that on to our patients. And so like yourself and myself and others that have come around saying like, yeah, this isn't really meeting that criteria. It's great about, damage control. That's fine. But, what about preventative health, preventative medicine, just to be healthy in the first place? And I think that attitude is still there. And so that it's good to see that more people are coming around and saying, okay, how do I actually do this? That was my goal going into medical practice. But I'm going to have to self-educate.
Yeah, it was definitely, definitely awesome, baseline education of physiology and anatomy and all this kinds of stuff, that you learn about the body, but it has nothing to do with, it was really focused on, identify symptoms, diagnose, treat, whatever that treatment may be, based on, your discipline or whatever. But it was not like, what's the actual cause of this?
Yeah.
There was like, whenever they thought they knew the actual cause, you'd hear about that when you talked about a certain disease, but it was very identify, rather than or identify the symptoms rather than what's causing them. Why do we get sick? Why are we so sick as a population in general? There was no questions like that, and wondering that kind of stuff because, I guess in the end, the answer is because it's not profitable to think like that in a Western medical system that we have. But at the end of the day, like that's the meat of it, so to speak. We have to know that. And unless or else we're just going to keep getting sicker and sicker and have no solution, because clearly this pharmaceutical based method of healthcare is not working because the disease numbers are growing and growing. So we have to start asking ourselves, why do we get sick, and how do we recreate an environment that that allows the body to not be sick, because the body doesn't want to be sick. It's not like you have these genes that are programmed to, oh, you're going to get sick one day because your genes tell you to. It's the genes interaction with the environment. So how do we change the environment rather than try and force it to do something that we want to with a medication or procedure or something? It's like, how do we change the environment so the body doesn't need that procedure, that medication? It's doing what it needs to, because it's just trying to do the best it can in the environment that it's in.
Yeah. And your body's really robust. I mean, we can handle a lot of crap. And I think that's probably a problem, like big cats or even small cats, felines in general. They, we call them obligate carnivores. I think we're obligate carnivores too, because we are obligated to eat meat. We don't actually need to eat the other things, and those other things can cause harm. But to cats and felines, and to a lesser extent canines, like just basically any plant will kill them. Like they get really harmed. So they have to stay in that narrow window, and they want to anyway. It's just a natural thing. They want to eat meat. They don't want to eat this other stuff. And so, I think we're obviously you get a survival advantage by being able to be a bit more lenient at certain times when you have to be. But when we're in a situation as we are now, when food's eminently available in the Western countries, you're kind of, it actually is a disadvantage, because you can get away with it for a while and you don't see how bad of a problem it is. Whereas like a cat will eat this stuff and it will just get very, very sick and poisoned right away. It's like, okay, can't do that, and, so we're sort of a victim of our own robust nature. But you're right. The body doesn't want to be sick. It wants to work properly, and you throw poison into it, and it's just trying to work around that poison as much as it can. But, it does cause problems, and heart disease being one of them. And that's something that, you talk about. That's not necessarily how we've come to think of it. It's not really, necessarily cholesterol driven, or, and the causes of atherosclerosis aren't necessarily what we've been told it is, which is, fat and cholesterol. So can you tell us a bit more about that?
Yeah. So this is, one of the favorite topics that people want me to talk about or whatever, because I didn't come at it from a Western medical perspective. I didn't have this, I wasn't trained in that way, so I didn't have that in my head. So when I'm looking at this, I'm looking at this fairly objectively, I didn't have any idea what caused atherosclerosis when I looked into it. I've been told by doctors that it's cholesterol, but that idea just doesn't make sense when you look at the evidence. So first of all, the whole backstory of how cholesterol was blamed doesn't make sense, with the whole Ansel Keys thing. Yeah. And I'm sure your followers may be familiar with that, and how, before the theory was even tested, it had already taken off, and there was a lot of money behind it as far as the grain and sugar industries and things like that. And it was poor quality science to begin with. But if you look at the actual, mechanisms of what atherosclerosis is. It's clotting. It's not this buildup of, like cholesterol gets high in the blood and it slowly infiltrates the lining of the artery and slowly builds up. Like that just doesn't really happen. It happens when a clot forms. Just like if you get a cut on your skin, and in order not to keep bleeding, your body has to clot it to prevent it from bleeding. And so the same sort of thing, similar thing happens in the lining of an artery when it gets damaged or insulted or cut, so to speak, and they don't really get cut. Then the body, if it can't repair it, if it has poor insulin signaling or it has, poor endothelial progenitor cells or things like that, then it can't repair the lining and the body has to do something. Or else you're gonna rupture and bleed out, in that artery, and so it clots. And that's exactly what we see when we look at studies that have analyzed what atherosclerosis actually is. There are small amounts of LDL in it, and that's because there's Lp(a) in there preventing clot breakdown, but most of it is fibrotic tissue. It's fibrin, fibrinogen, and it's just this massive amount of it. Like over 90% of it is clotting tissue. And when they go in, when someone has this, complete blockage of an artery for a heart attack, they don't go in there and they administer cholesterol busting things. They do clot busting things. Those enzymes are the things that break it down. So it makes no sense that this accumulation of cholesterol is what's doing this. And further, cholesterol has been shown to, and saturated fat and lipoproteins, whatever form you want to talk about, has been shown to be very beneficial for humans. Like cholesterol, LDL, and cholesterol itself do many beneficial things. And it's the backbone of most of our hormones. It makes vitamin D. LDL combats infection. It helps cells communicate with each other. It's a large part of our brain is made up of this. So it makes no sense that this one molecule is causing all these issues when it also does all these beneficial things, which is why I also feel like the same about animal foods. Like if you have carnitine in animal food, you look at all the cardiac benefits to carnitine, and that's the highest amount in pork and beef. It makes no sense that this food would also be killing us. Absolutely no sense whatsoever. But then there's even question for me of whether or not that stenosis or the atherosclerosis that does build up actually causes heart attacks or restricts blood flow. And I talk about that in the book, but yeah, we can start with that. Like that the whole idea just doesn't make sense for all those different reasons. And there's a lot of science behind it too.
Yeah. Well, and that's true too. I mean, you don't just get like, clogged artery, even in the conventional paradigm, it's like, it doesn't just clot up and then close off. There has to be damage. First of all, there has to be damage for there to be an invagination of these foam cells and macrophages that suck up all the damaged LDL, and then, go in there to try to repair this damage. And that's thought to be what's the buildup of atherosclerosis traditionally. And then, but either way, you get this narrowing, and then there's another set of insult and damage to that lining that then makes this clot. And you're right, there's something going on there that you get a sort of an overreaction, you get like a big clot, because you do get these little tears every now and then. Your body generally makes like a normal platelet plug and then fibrinogen cap over that sort of seals that off. Whereas in these sort of strokes and clots and other things that we're getting, you get all of a sudden the thing fills up the entire vessel, and you can get that without atherosclerosis. You have vertebral artery dissections through trauma. Sometimes those can just clot off, but generally they don't clot completely off. They're clotting, and they can throw off emboli and things like that. You can have problems, but what we're seeing in these sort of pathological issues is the clot just fills up the entire vessel and then cuts off complete blood flow to that.
Which means it had to be significant enough damage to the artery for the body to have that significant amount of a reaction. Because I've looked at a lot of papers that show that lots of clots that form don't result in symptoms. The body just kind of heals it right there. But what happens when we get a stenosis, a narrowing of an artery, is that clot on top of clot on top of clot forms, and over time it's slow like that. Now, sometimes one of those clots could form and then it could get broken off or something, and that could flow down to a smaller area, and that could be stroke or heart attack or things like that. But from what I've seen, this slow narrowing of an artery, even if it gets to 80, 90, 100% blocked, if it's a slow development of that, people don't get symptoms.
Yeah.
And there's lots of case studies that show that, marathon runners have either been evaluated before they run or after they run, and they have like complete blockages of arteries that they ran marathons. It's like, how are they doing that? With no blood to certain areas of the heart. And the answer to me is collateral arteries.
Mm-hmm.
And I've been told by, different cardiologists that some people are fortunate enough to have collaterals, some people aren't. But I looked at the work of this one scientist named Giorgio Beraldi, who did these plastic cast studies. You ever been to like those Body World exhibits where they fill in the arterial system with like a plastic thing and they dissolve the tissue away and you have
those
this
are really
perfect map?
cool. Yeah.
He did that with hearts for like most of his career.
Mm-hmm.
And he found that, and I emphasize the word, any 70% or more stenosis of an artery in a coronary artery was always compensated fully by collaterals.
Mm-hmm.
So I like the body finds a way around that, which is why also when we look at the studies that show the efficacy of, bypass surgeries or elective stent placement, not emergency stent placement, but elective stent placements, they don't really prevent heart disease and heart attacks down the road because the body's already, it's already got those collaterals, it's already compensated. So compensating it more, opening it up more is not really going to help, especially if you're not addressing the main causes, which are, the metabolic syndrome and the inflammation and oxidative stress that's causing it. You're just doing something the body's already done in most cases, at least what Beraldi found in his work.
Yeah. And that was actually, my understanding of it as well, was that, everyone has these collaterals, you just don't necessarily use them. The way it was described to me in medical school was, you have the freeway, everyone takes the freeway, right? But if there's like a traffic jam or an accident or something like that, everyone peels off and takes the arterials, so you're going on surface streets to get around that blockage, and then you come back on the freeway and go on after that. And, but everyone has these collaterals. That was the point that they were making. They were all there. It's just that they take a certain pressure threshold to be utilized. And so if you have this blockage there, then these things open up. But they're already there. I think there was a thought for a while that, through sort of angiogenesis, you'd make new ones. But I certainly had a professor that was of the opinion that everyone has these, they're all there. And that, once you start slowing these things down, then they just start opening up and developing and developing more. And you're right. And that if you have this slow progression, that you actually don't have a problem. The problem would come like if someone was like 20 and that didn't have or 35 or something like that, and didn't have any sort of history of this. And then all of a sudden, through a clot and it had a major blockage and they hadn't developed their collaterals yet. And then those are the ones that have more devastating infarcts, where they have a larger body of the heart would be damaged. Is that your understanding as well?
Yeah, definitely. And that's actually a good point too. It's why that's why we're seeing more and more young people with heart attacks and things like that, because they haven't had, the pressure that their body would react to develop collaterals. But yeah. And even then, even that one professor you said they're already there. And that's interesting. I've never heard anybody say that they've always been there, and that they just develop more when they get pressure to. But I do know of a few studies, one in dogs and one in I think rats, where they artificially created a stenosis over a few days. And they found within as little as 4 days of creating a complete stenosis that the arteries were able to build around or grow around. So it happens pretty quick, at least in these animal studies. But yeah, so it can happen pretty quick, which makes sense, and to be clear too, like most of these studies were in coronary arteries. So I guess we really only know that, that can happen in coronary arteries, but I know that it happens other places too. I just don't know if it would happen as quick as 4 days or whatever. And Beraldi's work was all in the heart and coronary arteries. So there may be some differences there, but yeah, pretty fascinating stuff.
Yeah. Yeah. Very interesting. So what's your overall take on cholesterol? Yeah, I certainly have, made videos and talk about that, but what's obviously I think cholesterol is very, very good for you. So what is if it's not cholesterol, what's causing atherosclerosis?
Yeah. So when I'm talking about, it's initiating clotting when the body's initiating clot inside an artery, just like when you get a cut. So the question is what cuts an artery or what damages an artery, what insults it, so to speak. And there are lots of different things that could do that. And so I guess when we could say that it's oxidative stress, which is, these little molecules. I tell my patients they're the Looney Tunes Tasmanian devil. They go around like crazy trying to find a pair of electron, and they'll damage anything they can to get it. But there are lots of things in the body that can cause or can act like a free radical, cause oxidative stress. But some of the heavy hitters are like heavy metals or plastics or just toxins in general. But also oxidized fats can do that. So it's no mistake that we see association between oxidized LDL and atherosclerosis. And I'm not surprised that association is there, because the things that are oxidizing and damaging LDL are also damaging the lining of the artery. So that's why we see them at the same time. Not that one's so causative than the other, even though oxidized LDL doesn't help. But the big one that I like to talk about, especially in relation to the heart and the health of the heart, is psychological stress. That is a huge proponent of initiating clotting. So I talk about studies. I just did a presentation last Thursday at Roanoke College where I'm talking about this process that's happening. And I focus in on stress a lot because when you look at what happens during acute stresses, the amount of clotting factors that go up is just insane. And that's supposed to happen because your body's probably prepping itself for an attack of some sort. That would be the evolutionary way of thinking it. So it's like, okay, if we get scratched or if we get cut, we need to clot pretty fast. But the name of the paper is really interesting. It's when physiology becomes harmful, because this day and age, we are a species that can literally think our way into a stress response. We're the only species that can do that. We can overthink things. We can see something happen across the world, nowhere near us, and stress out about it, or fear it's going to happen to us. And we can get stuck in this chronically elevated stress state where we have this imbalance in our autonomic nervous system. And when we look at the evidence for how that stimulates clotting and how atherosclerosis is heavily associated with that, it's pretty fascinating. So there's that stuff. And then, just the key piece here is that all that stuff can be insulting the lining of the artery and causing clotting things to form. But normal wear and tear is just that. It's normal. And we're supposed to be able to heal from it. The lining of the artery is supposed to be able to repair itself to an extent. But that's dependent on a few certain things. One is whether or not we're insulin sensitive or not, because the growth and repair that triggered by insulin, especially in the endothelial cells, the cells that line the artery, is incredibly important, because if we're getting damage and it's not getting the signal to repair, that damage perpetuates, and then we get the clotting signal, because otherwise the artery is going to bleed out or whatever. But also endothelial progenitor cells are the specific cells made in our bone marrow that go and heal the lining of the artery. And if we have some people have genetically low amounts of those, but also diabetes has been shown to have less amounts of those, or people who are insulin resistant, or even type 1 diabetics like myself have been shown to have lower amounts of those. So that impairs the ability to repair that artery, which can lead to issues. That's when the real issues happen. So it's the combination of the things that cause the damage and then the things that inhibit the repair of the damage that become the problem. And that's unfortunately a lot of what's going on in society today.
Yeah. And I think that's the thing that people are missing, is that this is a very, very large and complex inflammatory disease process. And just breaking it down, this reductionist sort of view is just like cholesterol goes up, heart disease goes up. First of all, that's false. That is just false. There's no high quality evidence to even suggest that. And in fact, Ansel Keys and even the other studies, the Framingham study, all these sorts of things, all the actual results were misrepresented, and they never found an association between higher LDL cholesterol or total cholesterol and heart disease. They just never did. In fact, they found inverse relationships in a lot of areas, and certainly those were the large meta-analyses in the last 2 years have shown as well. But like you're saying, your body should be able to heal itself. And that's actually what we are seeing. We Dr. Asim Malhotra, a cardiologist in the UK, he wrote a book called A Statin-Free Life. He talks about, and he's actually one of the authors in one of those large meta-analyses looking at saturated fat and cholesterol. And he talks about how it's really this is an inflammatory process, mediated by things like you say, like type 2 diabetes, and that when you reverse that, or sort of when you will eliminate the inflammation and you sort of reverse these disease processes and these inflammatory processes, you can actually reverse this damage that you get as well. And we're actually seeing, coronary artery calcium scores go down once you eliminate these things out. Now you can do that with a keto diet, with low seed oils, or with a carnivore diet, or whatever you do. You can reduce this inflammation, and your body will start repairing itself, and that is what you would expect to see. Just understanding how the body works, right?
Yeah, well, evolutionarily, that would make the most sense. If we
Yeah.
want to survive as long as possible, we should be able to heal ourselves, which those mechanisms are there. We just have to activate them. And huge parts of that are animal foods, in my opinion, like vitamin K2. That's what takes the calcium where it needs to go. Once it becomes mobilized out of those arteries, and you put it back in the bone and the teeth, and not in other tissues. So, I mean, that's a huge part of it. And it fascinates me that there's, people out there that can deny that evidence, and like, again, I'll talk about carnitine again, but also creatine and carnosine, like all these different nutrients in animal foods, or higher in animal foods and more absorbed in animal foods. Those are the ones that, when you look at the evidence, it helps your body be more efficient, because carnitine is taking the fatty acids, putting them into the mitochondria, which is the heart especially prefers fatty acids for fuel, which is really interesting, because even in the presence of glucose, it will choose fatty acids and ketones, which is interesting, because like in muscle, glucose will be burned first. But in heart muscle, it seems to be different. But carnitine is what's allowed us to do that. So carnitine has been shown to, improve insulin resistance, or prevent it, which is that final piece of that atherosclerosis that we don't want. We don't want the insulin resistance, because then the body can't heal itself.
Yeah. The brain too, and brain prefers ketones. That's one of the
Oh
funny
yeah.
things. Yeah. Like, I mean, I learned that in biochemistry 20 years ago. The brain
Mm-hmm.
always runs on ketones. And
Mm-hmm.
once your ketone level goes up to a certain point, regardless of your glucose levels, your brain will just switch, will just like shut
Mm-hmm.
off, shut out the glucose, and exclusively run on ketones. But it will always run on some ketones. Even when you're in a low ketone, high BSL state. And so I don't think that the argument that glucose is our brain's primary energy source really holds water when you look at it in that
Mm-hmm.
way. So yeah, and you have these different tissues that preferentially go for ketones, which is it is interesting. Um, and as far as animal foods go, do you do a full carnivore diet yourself? Do you do keto, or you just eat, like, want to promote meat, but you're okay with other things as well?
I was on a full carnivore diet for about 2 years,
Mm-hmm.
and I will say that that was the 2 years that I fixed my gut finally. Because
Good.
I'd always had gut issues, that was inflammatory issues, and it was way better with the diet changes that I made, but I still had some gut symptoms.
Mm-hmm.
And when I went carnivore, that's the first time I didn't have any gut symptoms whatsoever.
Nice.
And since I've added some plants back in, I mean, I'm probably 85% animal foods. Since I've added plant, like, the gut symptoms are gone still. So it's
Mm-hmm.
like almost like that was the only thing that allowed my gut to heal. The only thing that I've ever tried, and I've tried a lot of things. But yeah, so I'm generally a fan of eat a diet that's going to create metabolic health, that gets you all the nutrients you need. And in my opinion, the best way to do that is a diet very high in animal foods.
Mm-hmm.
That's what humans have been eating for millions of years. I guess pre-humans and humans for millions of years, and that's what serves us the best, in my opinion. But just like evolutionarily, like you were talking about, like, it was advantageous for us to be able to digest some other foods, but it doesn't mean that was our first choice. I often
Mm-hmm.
say, like, if an animal, the I guess 9 or 10 months out of the year had to survive off pudding, and that was its best fuel source, right? Or this best food source was pudding for that animal. But 2 months out of the year, it had to eat rocks to survive. It better retain the evolutionary, characteristics and physiology to digest rocks,
Mm-hmm.
even if that's not its best food source, right? Because you need to survive for that 2 months when the pudding is not available.
Yeah. And And so high fat or
Yeah. Um, yeah, definitely higher fat. Well, especially for me, I'm type 1 diabetic and
Mhm.
low carb is so much easier to
Yeah.
control blood sugars when I do that. So especially for me, but yeah, definitely higher fat. I'm definitely a lean mass hyperresponder, as Dave Helpman has coined. When I go super low carb, especially when I went carnivore, I had that massive LDL number that freaked everybody out except me.
Yeah.
But yeah, definitely higher fat because that's the body's, I think, best and most efficient fuel source. And especially, when I'm looking at the heart, like in this organ that's contracting all the time, using up a ton of ATP, there's a reason that it even in the presence of glucose will burn more ketones and fatty acids because it needs to be efficient. And it needs to, create less oxidative stress and things like that. So definitely higher fat.
Yeah, good. And all right. So and you're saying before, like there's some are there specific foods that are good for the heart as well, or is it just meat in general, or there's anything specific?
I mean, if you want to, like, eating the heart itself, like heart
Hmm.
organ meats, that's definitely helpful as
Hmm.
far as like the nutrients, especially the CoQ10,
Hmm.
which is going to basically be this super metabolizer for efficiency in mitochondria. That's really really important. But then, like I mentioned, like the carnitine, especially, and I remember carnitine specifically because I had a biochem professor that was like, this is going to be a question on national boards. I guarantee it. What does carnitine do? It takes fatty acids into the cell. And lo and behold, there was a question on board. So
Yeah.
that's what it was. And yeah, like I said, it's just no mistake that we find that in higher amounts. But also the saturated fat, when we burn that, it's more efficient, but it also creates more satiety, which is going to help you not eat as often and cause these issues with oxidative stress from eating too frequently. But let's see what else. Animal foods. I mean, the K2 I mentioned as well. Like we pretty much only get that from animal foods besides fermented soy, but who wants to eat that? And
I mean,
yeah, and all the B vitamins, especially uh, all in higher amounts, especially in the liver, things like that. But yeah, it's like these are the foods that are also our physiology has kind of adapted to absorb direct absorption. That's what we're more in line with, like wolves and things like that. So I'm not going to sit here and say that everyone should be a carnivore or needs to be healthy, but those foods make the most sense for our physiology for sure.
yeah,
Um,
and they certainly
yeah,
make it easier. I've
yeah.
I mean, I've played, a lot of sports throughout my life. Most of that was done eating, sort of a standard diet, not a lot of sugar, not all that much carb, but, just a normal diet. But I always liked meat. So I prioritize that. You can get in good shape. You can get ripped. You can get low body fat. You can perform at a very high level. It takes a lot more work to do
Mhm.
it when you're eating different things. When I'm on a pure carnivore diet, it is so much easier to maintain my
Mhm.
physique. I don't work out at all. I mean, like it's been months, and like I haven't done really much of anything. But I still maintain my body mass and lean physique. It's so much easier. And when I do get back in and I'm doing sports, I'm doing athletics and working out, I get back. I certainly I don't lose nearly as much, and I get
Mhm.
back so much quicker. And so it's much 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 easier, and that just makes sense physiologically that this is really what is good for us because it just makes better health easier.
Yeah, I experienced something similar because I used to lift weights a lot and I do again now, but like there was a time like that first year I was on carnivore, I was doing more soccer. I was playing a lot more soccer and I wasn't lifting weights. Sometimes I think there was one point where it was like 3 months where I hadn't lifted, but I didn't lose muscle
Mm.
mass um, when I was eating all animal foods. I was getting enough protein to maintain that muscle mass, even though I wasn't, stimulating the muscle as what I used to. I mean, with legs, obviously playing soccer, I was a little bit, but not the heavier weight that I used to do. So
Mm.
I thought that was interesting, but yeah.
Yeah, definitely. And you mentioned something interesting as well that about just the purpose of the heart as well. You
Mm.
don't think it's just to do with pumping blood. Can you explain that?
Yeah, there's actually a lot of evidence out there that I talk about in my book, and there's actually whole kind of research books written about that the heart is not the main mover of the blood. That's not the purpose of it. That it's there for a reason, but the blood more or less moves on its own.
Mm.
And this is why the efficiency of the fuel source of the heart is really, really important, because it's more, it doesn't act like this pressure propulsion pump that forcefully sucks in fluid from somewhere and then forcefully pumps it out somewhere else. It does do a little bit of pumping, but no more than is enough to kind of move the blood through the ventricles and the atria, and then maybe into the aorta. But other than that, if you look at the size of the heart and the amount of force that it can create, there's no way it could pump the blood forcefully throughout the entire body. And if you look at if you kind of like the logic of it too, like if I was going to put a pump, if I was going to pump water or a fluid up a hill, where would I put the pump? I'd put it at the bottom of the hill. Yet the heart is kind of in the middle of us, and so it's pumping down to the feet, and it's supposed to be able to pump all the way back up to the heart. And the physics of it doesn't really make sense. And there's a lot of evidence there. Like if we look at in a fetus before the heart's even formed, the blood is moving. Mm-hmm. And there is contraction of muscle, and there is one-way valves in the veins and things like that. But the mechanism by which the blood moves, which kind of takes us back to atherosclerosis and why it's so important that the lining of the artery is so healthy, is because water. So this all comes from the lab of Dr. Gerald Pollack up at University of Washington. He's shown that water has the ability to hold energy. And when it does, it actually structures itself into what's called this fourth phase water state. And it's got different names. It's got structured water or exclusion zone water. And when it does this, because, the blood is about half water, when it does this in an artery, it actually forms this energy gradient that actually propels blood flow. And they've shown this, they've done this experimentally when they stopped the heart from beating in dogs like a long time ago, and the blood continued to move for hours. But they've done it in Dr. Pollack's lab in chick embryos, where they stop the heart and the blood continues to move. And as long as they put radiant energy into the system, it continues to move, because the radiant energy, like infrared light, is one way that water actually can hold energy or absorbs energy. And so one reason that the heart is there is because another way that water gets the ability to hold energy is that it's swirled around in the presence of oxygen. And oxygen's always there in the blood. And the heart, if you look at the orientation of the heart muscle, it's this spiral like nature. So when it contracts, it spirals, it vortexes, swishes around the blood so that it energizes the water. So when it gets into the lining of the artery, it can structure itself and perform these mechanisms that propel blood flow. And that may be a lot for people to kind of grasp or wrap their head around, but I detail it all in the book, and how the heart is actually more like a hydraulic ram, which operates when fluid is already flowing into it. There's no forceful sucking or pushing out. It's the water that flows into it that activates it. And so it's actually two hydraulic rams that are kind of put together. And then the other purpose of the heart. So the one purpose is that it vortexes the blood as it moves through, but the other purpose is actually to stop blood flow in times when we're using our bodies very vigorously, like during athletics. And there's actually lots of studies that show that the reason that an endurance athlete's heart grows and the muscle gets bigger and stronger is not because it's more forcefully pumping. It's because it's more aggressively stopping the flow of blood as it's flowing in very forcefully. Because if we were to go for a run or do anything athletic, and like the tissue would demand the blood, and that would increase the flow to the arterial side, to the tissues, and the venous side would pretty much collapse, because if the heart wasn't there. But since the heart is there and it stops this, it kind of maintains the pressure between the two systems so that it can be equalized, so that it doesn't collapse and we don't die during exertion. And they've done these studies in soccer players mostly, but really interesting, because if we step back and realize, well, what's the point of knowing all that? Why is that important? It's because if we don't understand the true function of the heart, then it's really hard to understand what like heart failure is, And so the thing that drives all this home for me is that infrared light is one of the main ways that the water in our blood absorbs energy. And when you look at the studies on people with heart failure, the people who think their heart is failing, when in reality it's these mechanisms that propel blood flow in the periphery that are failing. And if we look at the studies on those people with infrared sauna use, it's phenomenal. These people have complete turnarounds in their disease, like their ejection fractions increase tremendously, the swelling goes down, the heart size goes down, everything. It's I don't understand why there's not an infrared sauna in every cardiac rehab center everywhere, but it's pretty fascinating to look at it, think of it like that, but it's really important to understand as well.
Well, it's very interesting. I mean, obviously the heart has obviously a function, and
Mm,
you're saying that it's, I mean, even just to pump, right? Because, if we have an arrest, we need to, perform CPR and things like that. And, someone will expire otherwise. Um, is there still like a bit of blood flow, or it just has to like just kickstart the system and just sort of get things sort of moving, or what's that mechanism?
what do you mean, like for CPR?
For CPR, yeah. So if when the heart arrests, and things do stop, and you stop perfusing your organs and your brain,
Mm,
presumably, I mean, so that's obviously why people think that this is a pump mechanism, because this is going,
right.
but it sounds more like a priming event to sort of get the ball rolling, and then everything else sort of just takes off after that. Is that right?
Yeah. So if a heart stops contracting, the
Mm-hmm.
valves stop opening and closing. So that would prevent flow
Mm-hmm.
right there. So that's what the compressions are for, opening and
Mm-hmm.
closing valves so that blood can continue to flow. But more or less in the periphery, the blood is flowing on its own.
Mm-hmm.
And like I said, the heart does do a little bit of pumping, but it's no more than enough to get the blood through the art or through the chambers of the heart.
Mm-hmm.
It has to do that. And also, if like I said, the heart is kind of a vortex, and it spirals or swishes around the blood, and that energizes it. So if we don't have that mechanism happening either, then that will delay, or that will interfere with the flow of blood in the periphery.
Mm-hmm.
So that's why the compression of the chest helps, is because it forcefully opens and closes the valves so
Mm-hmm.
that the blood doesn't just get backed up, right? But if we look at the heart as this thing that forcefully pumps the blood throughout the entire body, there's no way that can happen. The physics of it just can't, based on,
Mm-hmm.
there's scientists that say that we need a heart the size of a whale to do that.
Mm-hmm.
So there's other mechanisms by which blood flows, and it's really important to understand those other mechanisms
Yeah.
to achieve health, really optimal health.
Yeah.
And like I said, the efficiency of the heart is really, really important, because, or like the energy source that it runs off is really important, because that contracting needs to be as efficient as possible, especially in people with heart failure, which is why hearts in failure prefer ketones. There's plenty of data on that.
Okay, interesting. And then so that flow through blood, is that laminar flow where it's like, you have sort of the different like, explain that, where like the blood's going through the vessels, and there's some sort of characteristic of that that's actually helps propel it as
Yeah,
it's
so
going.
when we look at water, it's H2O, right? So when
Yeah.
when water structures itself next to a hydrophilic surface, which the lining of
Mhm.
an artery is a hydrophilic surface, and this happens in nature too. So people need to ask themselves, how does water get from the roots of trees up to the leaves?
Mhm.
Like the same mechanism happens. And so when it does that, it cleaves off one of the hydrogens. So we're left with just an oxygen and a hydrogen. And those oxygens and hydrogens team up with other oxygens and hydrogens, and they make this lattice, like planar like structure that lines up next to the hydrophilic surface.
Mhm.
And what that does, that becomes a very electronegative space, because the oxygen
Mhm.
is a bigger molecule, and the hydrogens that are left in the lumen of the artery make it a very electropositive space, and that creates an energy gradient that propels flow. And they do this over and over again. They put a hydrophilic tube inside water, into a water energized water, and the water just starts to flow through the tube with nothing else going on. It just starts to happen. And as long as it's going in one direction and energy is placed to it, it will never stop. It just keeps going. And so that's flow of water with no pump necessary.
Yeah.
So that's what we find happening in arteries and plant roots and various things throughout nature. And so, yeah, that's the kind of direct mechanism. But the other thing that's really interesting is that it's called exclusion zone water for a reason, because it excludes anything that's not it. And the only thing that can really penetrate it are small hydrated ions of minerals. But even like the small protein albumin can't get through it. So it acts as this protective layer as well. So you got this layer of water, you got the glycocalyx, you got the endothelia, all these different layers of things. And that one, if we keep it intact, protects the lining of the artery as well.
Awesome. And so just obviously a bigger question, but hopefully not too big. Um, so what is heart failure then, if not just the failure of this pump to move fluid throughout our body? What's going on there?
So it's the failure of these mechanisms in the periphery. So
Mm.
the blood is not moving on its own, and then it could also be I guess contributed to by poor energy use of the heart. So
Mm.
glucose-based metabolism rather than ketones. But it's the failures of those, and then the heart is having to pump more forcefully than it's designed to or evolved to, because the blood's not flowing on its own. Then when it gets to the heart is having to contract more and push more, and that creates this dilation. It also creates swelling in the limbs, which is what we see in heart failure, and then congestion in the lungs and things like that. Because these mechanisms are not moving. I mean, the lymphatic system doesn't have a pump, but
Mm.
the blood or the water moves through that. The CSF doesn't have a pump. The spine kind of moves around and moves a little bit, but this is how water moves throughout the body, or fluid moves throughout the body, is these mechanisms. So we have to cultivate an environment that helps do that, to take pressure off the organs. That they're not doing that. They're forced to do that themselves.
Okay. And so what are some of those things, what are we doing that's going wrong, that's precipitating heart failure, and how do we prevent that?
Yeah. So the big one is poor metabolism, glucose-based metabolism, insulin resistance, things like that. But then that's all perpetuated by lack of blood flow. So if we want to energize the water in our blood, the sun is the original source of that, which is why it makes sense evolutionarily, because 40% of the sun's rays are infrared, which are the most absorbed by water. But also grounding, putting your feet directly on the earth. That electromagnetic field from the earth energizes the water in your body. Other living things, which is why human touch is so healing. It does that as well. Like the right type of light, or like the wrong type of light, the fluorescent lights, the filtered blue light, it can impede the energizing of water. But then, so just nature exposure, being in touch with other living things like that. And then eating the freshest food possible, because the water is not just structured in the lining of the artery, it's structured in all the cells of living things. And so the fresher our food, the better it is, the more energized it is when we're consuming it, which is why I like animal foods, because we're eating the cells of animals that have to be pretty fresh. We're not going to ship those around the world, or at least we don't. I get it locally from a farm, and I can do that pretty much anywhere. A cow can grow. So those types of things will energize the water, but it's really a light environment that's the best.
Okay, cool. And I was just going to say too, for people that, we actually do see these mechanisms sometimes. You say that like this stuff's flowing on its own, and that's interesting. We don't necessarily know why that is all that much, but something was explained to me when I was taking molecular biology, was this thing called Brownian motion, which is just the normal motion of these molecules, right? And they're just bouncing around and flying around and just moving constantly, and temperature obviously speeds up that. That's what temperature is these molecules are going around faster. And that's why that increases reaction rate, because you increase the temperature and you increase the speed. And so you're going to create more interactions between these chemicals, and you're going to have more chemical reactions. But that Brownian motion is just this natural motion of the molecules in water and the air and in our cells, actually produces enough energy to account for all of our kinetic movements. Just that energy in the cell, just the molecules moving around. As people are, and this is why people, some people thinking like, are we even in control of ourselves, or is this just a pure chemical reaction? That's sort of getting that sort of that self-determinism versus everything's scripted, and it's just like we're just this is just all happening no matter what. But that is something that we see, and obviously I think very much we have free will, and when this isn't random. I've chosen to do that, but there is enough energy in Brownian motion in the cells to account for all of this. For everything that happens, there's enough energy just going around from just the banging around of molecules. So there's a lot going on that is going to take a long time to figure out. So that's pretty interesting about the flow.
Yeah, I mean, and we always hear things like, I'm 75% water, 80% water, like our bodies are made up of that. It's just like, well, if we're made up of so much water, it would make sense that our physiology would be extremely impacted by that water. And as far as Dr. Pollack and others before him, Dr. Lang and Dr. Alberts in Georgia, they found out that water has these very unique properties that we haven't even really tapped into yet. And so that's what he's exploring in his work and his books. And so it's pretty fascinating when we apply it to human physiology.
Very good. All right. Well, Dr. Hussey, it's been an absolute pleasure speaking with you. I'm sure we could go into way more depth in this, but it's very, very interesting. Where can people find you and find your book? What's the name of your book? And just tell us where we can get more of your stuff.
Yeah. So my website is resourceyourhealth.com. My books are on there. My blog's on there. I do online coaching so that people can find me there. My book is Understanding the Heart. Surprising Insights to the Evolutionary Origins of Heart Disease and Why It Matters. That's on Amazon and Barnes & Noble and things like that. You can buy it from the publisher website. And then I'm on social media, just Dr. Stephen Hussey, Stephen with the PH. People can reach out to me there, Twitter, Facebook, Instagram, things like that.
Perfect. And we'll put all those up in the show notes as well. All right, Stephen, absolute pleasure. Thank you for coming on. It's been great talking to you.
Yeah, thanks for having me.
No problem.